Hi, hello again. Welcome back to the channel. This is Dr. Walker from DenWalker.com. Welcome back. Today, before we get started too far into this video, if you like what it is we're talking about, go ahead and hit that like button for me so we can continue giving you some of this good information. Anyway, so yesterday I was listening to a cardiologist and he was having a discussion about statins and how beneficial statins are for the individuals. And how they absolutely, was the term he used, absolutely reduce your risk for heart disease and heart attacks. The next thing he said was that statins, especially when you combine that with exercise and proper diet, that absolutely save lives. Now, most things you listen to in terms of their pill discussion or medication discussion, they always tell you that their pills will work if you have proper diet and you're exercising. And what I'm trying to tell you is the key is exactly that: proper diet and exercise. Then you won't need their pills. You won't need their statins. You won't need their weight loss drug. You will not need that. Just be cognizant of the types of food you're putting in your mouth. For example, if you are having lots of processed foods, cookies, cakes, high fructose corn syrup, and those kind of things, yes, you're putting yourself at risk, right? You're putting yourself at risk just with those types of food. It doesn't necessarily mean, though, that you will need their pills to help reduce your LDL or increase the HDL, right? It doesn't mean that at all. It just means that you need to watch what it is you're eating. Again, processed foods, starchy foods, high sugar, essentially diet, cakes, cookies, high fructose corn syrup, those kind of things, those will put you at risk for high inflammation. The high inflammation will lead you to having heart disease, heart attacks, strokes, and those kind of things. And so that's not what they're telling you. They're telling you that you can take this one little pill, and in addition to that, you exercise and you eat right. And I'm telling you that if you just exercise and you eat right, you will not have to take their pills. On that same note, more discussion about what they're talking about was essentially looking at the LDL, your LDL cholesterol, and if your LDL was too high, and right. Key is when you get your lab work back for your blood work specifically, and your LDL is, 160, and those things, your HDL is, 50. It really does make a difference, right? Look at these numbers for me. Look at your triglyceride HDL ratio, and let's say your triglyceride, let's say, is 100, and let's say your HDL is 50. So now you have a 2-to-1 ratio. What you really need is you need to get that ratio down from a 2-to-1 to ideally a 1-to-1, right? So your triglycerides may be 80 and your HDL may be 80, and that is perfect, right? If you are in that zone, it suggests to most of us that your system is not, from that standpoint, not high in inflammation. If, though, you have a 3-to-1 or 2.5-to-1 or 5-to-1, right? Triglycerides to HDL ratio, that is high inflammation, which means really that your sugars are too high. Because remember that those triglycerides essentially turn into fat at some point, right? So you really need to watch what foods are being converted into fat, i.e., if your blood work is high in sugar, essentially, those sugars are turned into fat, right? So it suggests that your triglycerides from that standpoint will be too high, right? So what you need, again, you need your triglycerides and your HDL to be around the same. Now, the other thing you can probably look at also is look at your LDL to triglyceride ratio as well. If your LDL is high, let's say 130, and your triglycerides are low, let's say 100, it suggests that your inflammation is not that high. It also suggests that your diet's pretty good. If, though, you have a triglyceride that's high and your LDL is also high, it suggests also then that your inflammation, your system is inflamed, and you're eating some things wrong. Specifically, you're eating things that give you a high triglyceride number. And those things, again, goes back to what I said before. It's that what you put in your mouth. Processed foods, cookies, cakes, high carb foods, rice, breads, pastas, high fructose corn, I talk about that all the time. High fructose corn syrup, those things are the things that make your triglycerides high. And again, it's a processed food thing, right? So if you can get your triglycerides look to control your triglycerides first. Down. If your triglycerides are down, it suggests to most of us that your system is not very inflamed and you're probably on the right track, not necessarily needing a statin to, quote, decrease the LDL. And LDL really, in and of itself, which is what statins are boasting that they can do, it may drop your LDL, but it does not prevent the thing that's going to cause you significant heart disease, i.e. that the plaque that's not hardened yet. It doesn't really stop that part of the plaque burden from happening or rupturing, right? If that soft plaque ruptures, you're in trouble, right? What you're trying to do is try not to have those, that soft plaque. And again, the statins have very little to do with that. It will lower your LDL, but to what end? What is the goal of lowering your LDL? And some people also suggest, which I believe, that really LDL is just a marker of inflammation, which really means that your body's trying to heal itself. The endothelial part of the inside of that blood vessel requires healing, and the LDL is the molecule that helps with some of that. So driving the LDL down lower than it really needs to be, it may pose long term to be more problematic than we're currently thinking. But anyway, that's not my discussion. My discussion really is about trying to get your triglycerides down to a reasonable number, where the HDL triglycerides are sort of 1-to-1 balance. Essentially, that should be your goal. And if your triglycerides are too high, again, do some of those things I mentioned before. Reduce your high fructose corn syrup foods, your high carb foods, your processed foods, breads, pastas. Reduce all of those and watch that triglyceride go down. And as that goes down, your HDL should also come up, and that should be good for a lot of folks. Anyway, thanks for listening, Dr. Walker.